17 million people worldwide are suffering right now with ankylosing spondylitis. If you're one of those, if you just have back pain and you don't know what it's coming from and you're looking for answers to try to figure this out, I think you're going to really enjoy this podcast. So stay tuned.
Hi guys, it's Cameron. Today we're going to be talking about a condition that is a very big word and is a little hard for me to pronounce. So we're going to get Dr. Cormier to pronounce it. Dr. Cormier, go ahead.
It's Ankylosing Spondylitis month, and this is technically March, and it's a condition that has the month of emphasis.
Yes. Thank you very much, Dr. Cormier. For the sake of our time, I'm going to be calling it AS for today, guys. So Dr. Cormier, what is AS?
So ankylosing spondylitis is a condition where a lot of times it'll start out just as back pain, where people will have some pain in the back or in the lower hips on either side. And if it's not taken care of properly, it turns into an autoimmune condition, which is called ankylosing spondylitis, where literally the cells in the back, the bones try to start fusing together. So it ends up being a life filled with many symptoms, especially of pain and discomfort, lack of mobility, where people just don't feel good.
I know that you look at autoimmune conditions much differently than conventional medicine would. Could you dive a little deeper into the autoimmune look?
Yes. So with respect to autoimmune, the conventional side believes that your immune system is erroneously attacking your good cells. Well, we believe a lot differently, where I think the body is protecting itself. So it's actually killing off some unhealthy and dying and bad cells in your body. And it's protecting from the bad cells hijacking and taking over your body. So when it comes to this particular condition, you want to think of these cells in the bone in particular should be, doing their job. And these bones should be separated from each other, and they should be moving freely as they're designed to do, as God intended. But unfortunately, these cells, they start by getting unhealthy, and they start getting filled with toxins, maybe microbes, whatever the case may be. They get unhealthy, and then they can turn into these autoimmune conditions like ankylosing spondylitis. There also is a genetic side, remember, with anything in your body. So you have each person's born with a certain set of cells, right? We have trillions of cells in our bodies. Each person's born with those cells. Nobody's born with a perfect set. Every person has what's called genetic defects, and some more than others. And each cell is pre-programmed with self-healing, the ability to heal itself of anything. But some of those cells, due to those genetic defects starting, don't have that high level self-healing. And so basically over time, we have physical stresses, emotional stresses, and environmental stresses on planet Earth that can knock the health off of any of those cells even more and cause crazy conditions like autoimmune things to happen.
With this condition, they say that the spine is also inflamed. What happens when a spine is inflamed and goes unchecked for a while?
Yeah, so anything with respect to any cells in your body that are not healthy, they can get inflamed, they can get aggravated, they can get hijacked by a virus, they can get hijacked by other microbes. So the longer a cell is unhealthy, the more inflammation can happen, the more problems that can happen around those cells. And there's a bigger factor too that we really think about as a connection between the brain and those cells. And the brain is connected properly, like a power company, to each one of those back cells. You think about all those bones, they have microscopic cells in each one of those, and each one of those cells is wired to the brain, which is crazy to think about that. And your brain, your whole life is like a power company for trillions of houses. And unfortunately, there's so much interference and stress in today's world that it's impossible to keep 100% powered up to all your cells. So literally with this particular condition, all it takes is for the brain to lose power due to some type of stress in the lower back to a group of cells. That'll start out with some pain. And if you don't address that connection and fix it, then it ends up with more and more and more of those cells being problematic.
With this specific condition, young athletic men, especially in their 20s, are often hit with the worst symptoms with this condition. Is there any reason why that would be so?
So you can imagine young male athletes. I mean, just think about like a a young boy, like a baby boy versus a baby girl, oftentimes males are just a lot rougher. And so when it comes to like male sports, there can be so much more. Men are bigger in size, they're stronger, and this is nothing taking nothing away from women by any means, but it's just science, right? Men are stronger, bigger, they have more bone mass, more muscle mass, and a lot of times they're rougher on the field with testosterone. So those factors. Just the physical side of those factors can damage. Remember, we talked about physical stresses can damage particular cells in the back that can lead to a condition like this. Compile that on top of some emotional stress, maybe in the sport they're in or in their life in general, with some environmental stress, which we talk about environmental stress. My goodness, there's 5G Wi-Fi, 10 going on 10G Wi-Fi, chemicals, pollutants, toxins, additives, preservatives. I mean, so much on the environmental side today. So all those factors lead up into some dysfunctional cells that can start this process.
Could AS actually fuse vertebrae together?
Yes, yes.
Wow.
That's how bad the condition gets, where literally, the SI joint in the back can fuse, the sacroiliac joint between the sacrum and the ilium. It can fuse between the lumbar vertebrae. It can start all fusing together. And again, the body's, it's trying to protect itself by doing something like this. Unfortunately, the conventional side, if they just suppress the immune system with drugs and stuff, that's not actually fixing the root of why this problem started. In my opinion, it started with unhealthy cells.
Can AS affect other areas of the body outside of just the spine?
So certainly, yes. In our opinion, we see areas that are trying to fuse. Like I see it all the time in the neck, for instance, where the neck is trying to fuse together. That would be another common area that we see it. But as far as these cells, remember, when a bone cell, I think the easy way to think about it is, if a joint in the body, all the muscles and the bones and everything are all connected properly, then those cells, that joint can bend and move and do all the things it's designed to do, and it's strong. But when you take a bunch of those cells that have lost power from the brain, then those cells are weak and that joint becomes weak and the body starts trying to fuse itself. So that's one area that we see. Unfortunately, it's kind of like this condition all around, where the body can try to fuse joints together.
Earlier, you talked a little bit about how genetics plays a role in this as well. We hear a lot about the HLA-B27 gene, where 95% of AS patients have that gene, but only 2% of patients that have that gene can actually get AS. Why is that the case? Why do some get it, some maybe don't?
Exactly what we talked about earlier. Remember, some people have there's three types of stress that can affect us outside of genetics, right? You have three types of stress that can affect your cells at any course of your life, which is crazy to think about. I mean, any emotional trauma you go through, any physical trauma, it could just be, going to pick up a heavy weight. That would be having some bad posture, right? It could be, having a car accident or a fall or an athletic injury. Any of those things. It could be falling out of a tree when you're a kid, that the cells never repaired properly, or falling off a swing. I always use that example. And then that's the physical side, but then you also have the environmental side. So it could be clothes that you're wearing, that are having impacts on your cells that we just don't think about. So it's a lot of factors. So to give you better, it just depends on the stresses that person has in their life and how it affects their cells. Somebody else may not have as many of those, and they may have this genetic trait, but yet they don't have the condition.
You have your clinic, the Nerve Health Institute, where you treat a lot of patients with different conditions. For this specific condition, AS, how would you go about helping this patient?
So again, with this particular condition, the sooner the better. I always think about, how many people have come to us in decades of being in practice with back pain, that we may have helped them from never getting this condition. Otherwise, if they would have not come here, maybe they would have developed this condition over time. So that's number one. Number two is when people already had this condition, and it's active and it's really trying to fuse vertebrae together. What we have to do is keep all those cells. We try to get those cells as healthy as we possibly can. We won't undo a fusion. if that makes sense.
Yeah.
But we can make sure that the areas on top are moving properly so that they don't wear down and cause further, because eventually this will just start to fuse, multiple areas of the spine and make things miserable. So the spine is like a set of chain links with vertebrae. And so each I always use the sound like when you're moving. That's not how you move, but that's kind of how these vertebrae are designed to move. They're bending, they're twisting, they're flexing laterally forward. So when you get a bunch of those starting to fuse, maybe on one side even, or not the other, then we start having limitations in the motion and stress on top and bottom. So that's where we come into play is trying to make sure we limit the effects, maximize the range of motion, improve the brain's connection and the power to all these things to where things don't wear out as much.
Yeah, things can get so bad that people can truly lose mobility.
Absolutely.
If that ever does happen, have you ever seen where somebody has lost mobility and been able to gain that back?
Yes, we have. We've witnessed plenty of cases coming to us where it's so degenerative, where the spine literally is fusing together and it just needs a spark. But we've been able to see some of the worst cases we've been able to see is where they get their function back. You want to think of nerves in the body, like all the nerves, the brain is actually sending energy into muscles to make them work. It's sending energy into bones, all these organs and glands. So you can imagine the more of that power supply that gets lost, then the more this condition thrives.
If someone has been diagnosed, let's say today, with AS, what is something that you would tell them to give them a little bit of motivation or hope?
So I would tell them like I tell anybody, like, my wife and kids, my family, my staff, our patients. I think it's critical that you see the right doctor in today's world. It is absolutely critical when it comes to any kind of symptom that you have, because if you see the wrong one, you could just go in a bad direction and your health will never be the same. And my example, I always tell people, is when I hit my head on the chandelier many years ago, and had all the disc in my neck give out and I was paralyzed, my right arm paralyzed. Wow. If I wouldn't have done the right things, if I'd have listened to conventional medicine, they were saying emergency surgery now, go have emergency surgery. Thank God I didn't choose that path. And I chose my other side, and we got that 100% better. It's the same thing with these types of conditions. Yeah. If you choose the wrong path with this, and let's say you just rely on medications to help you with this condition, it's just going to Band-Aid things and not actually help fix the root of the problem, the weaknesses, the deep-rooted cell weaknesses that started it.
Yes. Well, thank you very much, Dr. Cormier. That does conclude our talk today. Very informative. Thank you very much.
Thank you so much, Cameron. If you can relate to what we talked about in this podcast, then subscribe to our channel and like this video, as it really helps the algorithm. Don't forget, if you want to help yourself with self-healing at home right now, then simply become a Body Chargers by Dr. Chris member. And remember, our clinic, the Nerve Health Institute, is open all year round for in-person visits. For more information, just click the link below.